Hey, welcome to my channel. My name is Susan Morgi and my channel is Nurse Sue at Fight for Kidneys. Today we're gonna get to know who is Nurse Sue and why she decided to start this channel about kidneys. Just a little bit about me. I'm a wife and a mother of two, a boy and a girl. I'm a nurse by profession. I have been a nurse for 17 years with 8 years working in renal care or kidney care, specializing in taking care of people that have had their kidneys have failed and they require dialysis to live. My education background, I have a master's degree in healthcare management with emphasis on healthcare policies, regulations, and how to bring the best practice in any healthcare settings. And that's why I think where I'm working right now, and that was my passion, is how to bring the best practice, how to make healthcare better, improve the quality of care and also financially, and how to provide quality care and affordable care at the same time. I currently manage a dialysis clinic that I have been doing in the last 3 years. And I really do enjoy what I do, and I enjoy these settings because it's from these settings that I have come to understand more about kidney disease, and everything that involve kidneys. So why did I decide to start this channel? My desire and passion to start this channel came from, it has been a journey, some years, like almost 2 years. Like I've been thinking about it, and it's that one you're like, okay, no, but then as I interact more with patient and staff, and family members and friends, because sometimes I encounter, a family friend, a family member, a friend, and even sometimes kids. And I have come to note, like, especially when I admit patients to dialysis who are newly diagnosed dialysis patient, we call them new ESRD, those people who have been told their kidneys have failed and they need dialysis. So I get to ask them questions like, did you know your kidneys have failed? To just find out what information do they have, because sometimes it's scary. And one thing that has been common, most people have said, I didn't know my kidneys were failing. I don't know what's dialysis. So and you hear some people say, I'll be here for 2 days, is that correct? And then I might go home. And sometimes, majority of the time, no, it's not that easy. It's not that a quick fix. You come and they do something. It's not like a surgery. You go and they fix you and you go home and everything is okay. This can be lifetime. And so that part of it is the one that have made me decide to start this channel. So why am I so passionate about kidney disease? I have done different nursing arenas. I have worked in home health aid. I've worked in home health, like a home health agency, like a nurse in a home health agency. I have owned one. I have worked in nursing home. I have worked in medical surgical unit, and I have also done I have done research. And then I also have now worked in dialysis for over 8 years. So I did 5, then I went to research, then I came back. And anybody who knows me, they know that nurse who loves dialysis, that's where my joy my joy and passion come from, just taking care of people in dialysis. And it's a rewarding career that I have really, really loved. So it's that thing about, after working in dialysis and meeting people who are newly diagnosed with kidney disease, I came to find out there's still not enough information that is going out there. There is some organization, they are really working hard, let's give credit where it is, that they're informing people, but people are still not getting it. And I feel now that we have so many arenas and platforms that we can engage people, and especially people who know me, who see us, who like that we interact with patients in a dialysis setting, probably thought that, hearing from us, that of hearing from somebody like me, that might help improve and bring that awareness because it connects. So I have noted that most people that are starting dialysis, they have no idea why their kidneys have failed. They went to the doctor for some reason or the other, just for some fake symptoms. They might say, hey, I have not been sleeping. Or they were like, oh, I have been feeling so tired, and they're just going for that. Or they'll say, hey, I've been having these bad headaches, or they say, hey, I've not been urinating like I usually urinate. It's those things that are taking them to the doctor that they come to find out their kidneys have failed. So that's why I feel education is power. And with the technology right now, like we have realized, and everybody out there have noted that, especially during the coronavirus, most people spent time on their screens, on their Facebook, YouTube, Snapchat, Instagram, and all those other ones that I don't have any account with them, probably TikTok. I don't have an account with TikTok, but that's another platform that people are spending time on it. And I feel if we can talk about it and reach people where they are spending most of the time, we can bring awareness of kidney disease in the community and change. And the good thing, it's like with technology, it's not just you're not just tied up or in one area. Like say I'm doing it right now in America, but I know I'm originally from Kenya, but I know there's somebody else in Kenya who will see it, and somebody else in Kenya tag me to somebody else in Tanzania, and somebody else tag me to somewhere in, that way it's like we can bring awareness all over the world, because this is one condition that there's not so much awareness, but it's very costly. It affects a lot of people, especially financially. It's very draining, especially for those countries that the healthcare system doesn't cover it. That means the family members have to. So how can we change that narrative? How can we bring awareness so that people can have some preventive care, so that people can seek medical care and ask those questions that are related to kidney disease. So currently, what does the data shows? Like I said, kidney disease, and this is my little kidneys. Kidney disease can affect anyone, and especially if you have 5 major risk factors that we'll discuss later, but there are 2 that I cannot pass this channel without talking about it and without mentioning them, and that's high blood pressure and diabetes. And diabetes, it's affecting so many people. Actually, I read one article, and you find out before, when I grew up in my country and in Kenya, that time used to hear people with diabetes or high blood pressure were the rich and the famous, because and that has to do with lifestyle. And when I grew up, I didn't know kids that were diabetic. We thought diabetes is for older people. But right now you come to find out it's people within the age of 25, especially the data in Kenya is showing 25 and above. Really suffering from kidney disease, have these risk factors. So that's one thing. So, but one thing I would like you guys, when you come out of this channel, is to know that 33% of adults in the US are at risk for kidney disease. That means it's me, my husband, and another person. We could be at risk for kidney disease. And so it's one person out of those 3 could be at a risk for kidney disease. Me and somebody else, we could be at a risk. One of us could be at a risk for kidney disease. And the big thing and the major thing that it's really, really, it makes you feel, oh, wow. So can you imagine 37 million adults in US have kidney disease, and most of them don't even know. So that is like a timed bomb. You know, you're walking, like I said, most people, they walk to the doctor because they had these other problems that they notice, like, hey, things are not working like it used to be. Can you imagine those people? They go to the doctor and that's when they find out. So how can we change that narrative? How can we let people know about the kidney disease? So like I said again, diabetes, blood sugar, let me put it that way, high blood pressure, because most time you might hear me interchange diabetes and hypertension. So it's blood sugar and high blood pressure, and those are the main risks for kidney disease. So how can we change the narrative? You and I can change the narrative of kidney disease by subscribing to this channel, letting 3 people know about this channel. So why am I asking you to let 3 people know about this channel? Because if 1 out of 3 people are at a risk for kidney disease, then that means if somebody gets to know, watch this channel, hear about it, that they might trigger them when the next time they go to their doctor, they ask for some checkups, they ask for some labs, they ask some tests to get them to know how their kidneys are functioning. And being your own kidney advocate. And I want to bring something that why I feel like talking about kidney disease, talking about kidney awareness. I will give you a story that happened, not for kidney disease, but I'm just trying to tie this to see why sometimes we need to talk about things. So it was about 2012 that I was talking to a nurse that I had not seen. Like 3 days I didn't see her, and I was like, oh, why I have not seen you, where have you been? You know, I'm that bubbly nurse who wanna be nosy sometimes and ask my coworkers, where have you been? And she was like, oh, I had a mammogram the other day. And then the other nurse said, oh, how did it go? And she was like, I've never had a mammogram. And she was like, and then the other nurse said, you better get checked. You know, it's very important to have a mammogram. And at a certain age, they recommend mammogram every year or every 3 years. And this lady was at that age where she required to have had mammogram, or she should be getting it done. So she said, I've never had a mammogram. And we're like, okay, you need to go get checked. You need to schedule the mammogram. And sure enough, when she went and got her mammogram, the result came that she had breast cancer. And she was told, like, she need chemo. Like, right away, it happened so fast. And her life changed, like, drastically. But what am I saying? It's that conversation. If I didn't ask this nurse, where have you been? The nurse would not have said about mammogram. And this is what I find out, especially in dialysis setting. People are not talking about that I go through dialysis. They don't. They don't tell their friends. They don't even want some of their distant relatives to know that they go to dialysis or they have kidney failure. We have to stop that stigma. We have to talk about it. We have to bring that awareness. So I thank you guys. Thank you for joining me for this channel and to get to know me. And then I have here my body, and this will talk about it next time to show you about these beautiful 2 kidneys right here. So that's for the next channel. So tune in every Wednesday. I'll be uploading a new video every Wednesday so that we can keep to get to know the kidneys and fight for kidneys and fight. We gotta fight for our kidneys. We gotta fight for our loved ones' kidneys. We gotta fight, because this is a fight for you and me and for everybody else, because we can change the narrative just about talking about it. Thank you so much. Remember, 1 out of 3 adults are at risk for kidney failure or kidney disease. And how can we change about it? It's all about talking about kidney disease and bringing awareness about our kidneys. Thank you. See you later.